Good afternoon, everyone. My name is Gaurav Maini, and thank you for spending time after lunch speaking to a topic. I'm humbled to be here with two doctors. I'm not a doctor. I'm a computer science graduate. But I think this whole session, this whole conference is about doctors working with technology. So I believe that technology is an integral part of whatever we all do. And that's what I'm here to talk about on connected care and how do we empower patients. So I was reading a British medical journal which had some interesting data that doctors in India have about 2.3 minutes to engage with a patient in primary care. If you've been through the sessions today, you've seen that everybody who stood here has been fighting against time. There's so much happening in healthcare. I mean, when I was young, growing up, I forced my father to buy me a state-of-the-art computer, which was a 386. And now my phone is powerful than that. So we are at an inflection, not just in technology, but also in healthcare. There are significant trends that are driving what we do in healthcare. And I'd love to share some of the ones that we are working on as Philips, and some we feel that will touch billions of lives and will change how patients perceive how they receive healthcare. So I'm going to talk a lot about value-based healthcare and what is the value that patients perceive out of healthcare. We heard a lot about robotic surgery. It's great. Robots have big hands or small hands and big eyes. But what's the value that a patient perceives? So we believe that value-based healthcare is a quadruple aim. There are multiple pillars in value-based care. But essentially, we're looking to improve patient experience and lower the cost that a patient has to pay for the services that they get. So far, using our connected care and value-based healthcare solutions, we are humbled to be able to serve more than 5 million patients and more than 66,000 caregivers. We have a great footprint across the globe. We do work quite significantly in India as well. 29 hospitals of Fortis use our software. Apollo uses it. We even work with some of our competitors, Medtronic, and we have a significant footprint with them across the globe as well. And we're seeing that that's a global theme. Earlier today, this morning, we heard that the spend of healthcare in India is about $250, but in the US, it's about 9,000. And that spend is growing. But do we receive the value? Do we receive the return on investment? I mean, I see a large majority of us, we're Indians. We're known globally for people who want a return on investment, right? So what's the value that we drive? And how do we define value? I mean, we live in the world of Amazon, Flipkart, where you go and when you buy something, you look at reviews from people. You look at the price. Is that what is value for us? We look at reviews. When we all go out to eat food, there's Zomato. We check ratings. Is that how we should be grading our hospitals? So how should we define value? We should be delivering the best possible health outcomes at the lowest cost. And it's not just us, but there's a global media being led by this gentleman, Michael Porter, from Harvard Business School, and also working with an international consortium, where the idea is that this is how we should be measuring the value that you get of the healthcare service that is provided to you. In India, it's very easy. When you walk into a hospital as a patient, you're paying for service. But what happens after? You go in, you get a stent, you pay for the stent, you go back home. Did you get the value that you were looking for? From a hospital perspective, you're hemodynamically stable, you're going home, you're doing well. So which is where we've provided a solution called outcomes measurement. And we do have a live station. I think Amey is somewhere here. He can walk you through a complete demo in booth number 10. We'll talk about how do we empower our patients and how do we get response rates? How do we connect to patients? How do you know your patient is doing well? And there are multiple ways that outcomes come in. Do you look at costs? Do you look at their experience? Staying in a hospital bed, were you in a shared room? Were you in a single room? Was your experience good? What about the data that a patient generates? Again, let's go back to the example where somebody gets a stent in their heart. are they looking to walk 20 steps a month after their surgery without being breathless? Are they looking at walking on the beach with their grandson in 3 months? What is it that the patient is looking for? And how is it that we as healthcare organizations connect with them to really understand that what's your definition of your surgery being successful? So we have some front runners in trying to capture patient outcomes to try and understand that what really is an outcome. So Fortis has been on the forefront of it in being able to measure this, and they have publicly advertised their outcomes on their websites. They have more than 100,000 patients in India who are providing regular outcomes to them. There are 8 areas where Fortis has implemented outcome measurements. In the areas of cardiac care, in the areas of orthopedic and neurology, nephrology. And they have more than a 60% response rate, which is where more than 60% patients are responding back to Fortis saying how they're doing. And Fortis is now able to then publish their benchmarks saying that they are better than the best in the world. And how is this possible? By collecting data. And this is clinical data and also patient-generated data. We do see this, like I mentioned, as a worldwide phenomenon. So I'll jump to a more mature part of the world, a more, not a developing country, but developed country. So let's take an example of outcomes at Martini Clinic. Now, we know that the European Union is a developed area. So we look at how do we see outcomes different in different countries and also in different hospitals within that region. So if you look at outcomes measured for prostate cancer, if you look at specifically Martini Clinic, what you do see is that from a survival rate perspective, there's not a significant difference. Statistically, they're pretty much the same as the rest of the hospitals in Germany and Sweden. But if you look at in 1 year, what's the incontinence and what's the 1 year erectile dysfunction, you do see that patients who get their prostate cancer surgeries done at Martini Clinic see a significant better response compared to the rest of the hospitals in that region. But how do we know that? We know that by collecting outcomes. And the outcomes are being collected by patients who are responding to hospitals reaching out to them. You build that connect with your patient. And this is where we're seeing a global trend with insurance companies also coming in and wanting to pay for outcomes rather than pay for service. And we also talk about happier patients. If patients are constantly being connected with their hospitals, if the hospitals are checking in or the care organizations are checking in about the outcomes, that you had a surgery, how are you doing, are you taking your medication? So we talk about patient engagement, and you would see that the decision making also becomes shared because this also gives the doctors the opportunity to check that is my patient following my discharge summary that was provided to the patient. There are multiple ways that you can enable patients to provide outcomes. It could be by call centers calling out to patients. It could be by mobile apps, by tablet apps, by desktop apps. And then also, let's not make it too complex. Let's start small. Let's define outcomes first. Let's work with a standardized organization, ICHOM, which is an international consortium of health outcome monitoring. Let's figure out that how can you compare a patient, let's say, who's a 65-year-old male with diabetes, what is the journey that this patient goes through? And how is this patient compared against the rest of the population? Because patients want to know, what do I expect in a month? And the only way we will know is when we have these outcomes measured. And when you connect this with the cost data, this is where you figure out what is the value that is being driven for a patient. So I'm going to leave you with this slide that we do have a system that we can share with some data and show you how you can collect outcomes, how can you measure the data out of it, and make a change in people's lives. Thank you.